Hello, guys, welcome to another episode. In this episode, we will explore how to do first aid in case of bleeding. Bleeding control training is very necessary for pediatric population. So, the first thing is what is blood? Blood is a home to different chemicals and it circulates throughout our bodies. It provides our bodies with the nourishment that is required to survive. So, the quantity of blood in our body is approximately from 1.2 to 1.5 gallons, and the blood is approximately 10% of an adult's weight. For bleeding, there is a special medical term that is known as hemorrhage. Hemorrhage is the loss of blood. It can be external or outside the body, like when you get a cut or a wound, or it can be internal, like inside the body, like when you have an injury to an internal organ. Here are the examples of external and internal bleeding. The wound at the wrist shows external bleeding, and the loss of blood from a nerve in the brain shows internal bleeding. If blood is very important for our survival, then the point is what are the functions of blood? It transports oxygen and carbon dioxide. It provides us with nutrients and transport products of metabolism. It regulates our body temperature. It helps maintain homeostasis by stabilizing pH, temperature, osmotic pressure, and by eliminating excess heat. Now, the concerning point is how and from what components the blood is formed. So, the answer is that most of the blood cells are made in bone marrow, and the process of blood formation is known as homeopoiesis. The components of blood are white blood cells, platelets, red blood cells, and plasma. Plasma contains water, ions, proteins, nutrients, wastes, and gases. How to identify bleeding? Here are some signs and symptoms that help to identify bleeding: pale, clammy, cold skin, rapid pulse, rapid breathing, feeling dizziness, distress and anxiety, gray blue tint to the lips, pain at the site of injury, and loss of responsiveness. Bleeding can occur in different ways and from various sources. Knowing the type of bleeding can help determine the appropriate first aid or medical response. So, here are some types of bleeding: loss of dark red or maroon blood that is steadily flowing is known as venous bleeding. This is one of the type of bleeding, and this type of bleeding is slower and less severe than other types of bleeding. Slow oozing loss of blood from a small wound is known as capillary bleeding. Capillary bleeding is the least severe and can usually be treated with basic first aid. Loss of bright red blood that spurts out in time with the heartbeat is known as artery bleeding. This type of bleeding is the most severe and can be life threatening. After exploring the blood, its functions and components, types of bleedings, and the signs and symptoms of bleeding, let's see how to do first aid in case of bleeding. If someone is bleeding, it's important to act quickly to stop bleeding and prevent further injury or infection. Here are some basic first aid techniques to use in case of bleeding. So, the first aid techniques for bleeding are hidden inside the word bleed. So, let's see how we can use first aid techniques from the word bleed. The first letter of word bleed is B. B means barrier. This is the first step of first aid. Putting a barrier between you and the wound is necessary to protect yourself and the site of injury from external germs. You can use gloves and plastic sandwich bags as barriers. The next letter is L, that means locate. Examine the wounded individual to determine whether anything like a glass or nail is embedded in the wound or if a bone is poking from it. Additionally, if you find that the victim of the injury is in shock, let them sit or lay down and calm them if possible. The letter E in word bleed means external pressure. Apply external pressure to the wound, use clean cloth or bandage, and press down firmly on the wound. If the bleeding doesn't stop, add more pressure. The second letter of word bleed stands for elevate the wound. This means elevate the wounded area above the level of heart to slow down the bleeding. This is especially helpful for bleeding in the arms or legs. The next letter is D. D stands for dressing. This is the last step in first aid. For this step, use a sterile dressing. If sterile dressing is not available, use a clean cloth. While dressing, you observe that the blood is soaking through the first dressing. Do not remove the first dressing but apply a second one over the top. And once the situation is under control, replace the clean cloth with a sterile one.